from Virginia, Mr. Griffith, for your 5 minutes of questions.
Thank you very much, Madam Chair. Director LaBelle, I first want to say that I greatly appreciate the work that the Office of National Drug Control Policy does and the role it plays in combating abuse of controlled substances. And in fact, you mentioned one of the programs has been very helpful in my district. In fact, they'd like it expanded, and that's the HIDA program. Former Director Jim Carroll traveled to the district a little over a year ago, and we visited with the folks in far southwest corner of Virginia, where the opioid epidemic has hit particularly hard, although it's spread across the district. And prescription opioid abuse has been a major problem, as it has been in many districts. But for many years, the nation's highest per capita prescribing rates for opioid pain pills occurred in two of the localities in my district. One, it was 306 pills per person, and another, it was 242. So obviously, we can do better, and we are doing better. And I appreciate your work on this as well. And we have more than our share of illegal drugs trafficked in from China and Mexico. But the question is, how does the ONDCP's approach to data collection and recommendations differ between Schedule 1 and Schedule 2 substances?
So I think, I'm sorry, can you repeat the last part of the question, please?
Sure. What are the differences between Schedule 1 and Schedule 2 when it comes to your data collection and then the recommendations you make?
So the National Survey on Drug Use and Health is one of our tools that the Health and Human Services Department uses to collect data on drug use, and it has it asks questions about lifetime drug use, substance use. It includes alcohol. It includes Schedule 1 and Schedule 2 drugs, and they added a lot about Schedule 2. I'm sorry. They added quite a few questions about Schedule 2 drugs in the last couple of years, because as you said, we can't keep our eye off the ball of other types of substance misuse. What we're trying to do in our strategy, in our policy priorities, is look at this from a holistic standpoint, that it's not just about one drug. It's about all drugs. It's about polysubstance use, and that can include alcohol use as well, because we know that that's a substance that young people first start with, including alcohol and marijuana. So those are our issues. We work closely with HHS through their National Survey on Drug Use and Health to inform our policies.
And I appreciate that, and I appreciate recognizing that all substances may have a problem. I come from a family with some history of substance abuse, and so I've chosen throughout my life not to use any of the substances, including alcohol and marijuana. All right, new subject, Director LaBelle. In 2019, a federal interagency work group led by ONDCP recommended the use of permanent class-wide scheduling for fentanyl-related substances, along with legislative modifications to allow for easier rescheduling of any fentanyl-related substances with low or no abuse potential. This would allow rescheduling to happen in a more timely manner, and it would make it easier to conduct research on Schedule 1 substances. And I'm big on research. I understand that ODNCP is reevaluating permanent scheduling, but does ONDCP still stand by these recommendations to make conducting research for medical purposes easier?
So we're talking to HHS about exactly what the barriers are to research with the fentanyl scheduling legislation as it currently stands. We will be engaging with them in the future. We can build off of what was done and have that inform our work, but we need to make sure we're talking to them about the issues they're facing today.
Yeah, because I mean, I think this is an important issue, and I think we need to do research, because while some of this stuff is the nastiest stuff out there and has no benefit whatsoever, sometimes things have medical capabilities that we're just not aware of, and if we don't allow our research facilities and our medical teams to experiment and try to figure out how do you solve these problems, then we'll still be in the dark 20 years from now. So I would hope that you all would allow more research, even on Schedule 1, and figure out ways to make it so that it's practical and effective and efficient. And got a little bill that will help you do that, but that Dan Crenshaw and I are carrying. But I'm encouraged by your comments, and I yield back. Thank you, Madam Chair.
Thank you.
We thank the gentleman.